My name is Henrik Nannestad Jørgensen, and I'm a member of the Danish Ethical Council. And actually, I didn't know anything about artificial intelligence 2 years ago. I thought that was something you used in self-driving cars and so on. But I'm getting a little wiser every day. I'm the chairman of the group which is dealing with this question. But you know, in the ethical council, we have a lot of different problems. It could be about healthcare and environmental questions, and not all the other political things we don't cope with unless maybe in the private. But ethics, it's not. Actually, it's about why we're not always able to make the right things or have take the right decisions. And surely artificial intelligence, it's very complicated, and it's getting more complicated the more you get into the deep. One of the problems is, of course, storing and using what that was just what Mette talked about. But storing data, it's actually, I think, not an ethical question. It's just a question that that must be handled, and it has with technique to do. But using of data is quite another case. In our group, we have focused on different things. There's a lot of things you could focus on, but we have chosen to have focus on 4 items. And the first is how you use data in diagnosis. How accurate is the diagnosis, and what data is it based on? No system is better than the data it's built on. There's a lot of there might be a lot of biases, and of course these biases are not known to the ones who are dealing with them. There might be biases regarding to race or gender or not important things. For instance, it could be zip codes or and so on. And if you put all those data into the intelligence, and it's a self-learning machine, it might choose the wrong thing in the wrong tasks, and therefore there's a lot of things that might get wrong, and I'm sure that you who deal with that are very you know a lot of those things. And there's another problem or another task, and that is who approves the intelligence system, because when do you think it's good enough? When is it more accurate than a professional? You should be sure that it's better than a human being, and for many good reasons. The legislations is constantly lagging a little behind reality. As many of you might know, there's a lot of talk about it in the EU and in the Danish Parliament and Folketing. There has been a process the last couple of months about how to deal with data. There's another thing in this industry on this problem that is important for us to understand better. That is whether there might be winners or losers in the healthcare system, because a lot of the tech giants has a lot of access to data. There's a lot of data in Google or in Facebook and all the other Amazon and so on. But the public healthcare doesn't have all those data in the same way. So when it comes to treatments, then who take the easy ones and who should take the more complicated ones? It might be all the easy ones that are taken by the tech giants, and the public healthcare is left behind with all the complicated treatments. Unless, of course, there will be a correlation between the medicine industry, the AI industry, and the universities and the university hospitals, just in the same way as we have it in the medicine industry. But I think the public healthcare can't take that alone. It has to be a cooperation. And then the fourth problem, which I think is actually one of the very important ones, is whether my health data belongs to me or also to others. In Denmark, we have a very fine meshed network of health data around us. In Denmark, it's stored in different silos, and there's one at your doctor, the GP, and there's a silo in the hospital, and the municipality where you live got information about you. And right now, it's not legal to link between these three silos, although they together could make a high resolution image of us all. I think the indication is that it's a matter of time before these silos are opened and things are coming in use in crossovers. So therefore, the question is now whether you own your own health data in the same way as you own your bike, or does it belong to your fellow citizens too? Most of us, I think, we have a little laid-back attitude when it comes to painting a healthcare picture about ourselves. Maybe if we've got a broken arm a couple of years ago, yeah, that's okay. They can know about it, and they do. The flu in 2016, okay, yeah, that's okay as well. And the vaccines we've been taking during our life, it's okay. But what about the neural diseases, for instance, or liver diseases in connections with my bad drinking habits, or mental diagnosis? What about when I went down with stress last year? Who should know that? Blood test and so on, MR or CT scan results. Suddenly it becomes much more personal than just personal. And another thing is, what about my genetic data? Do I have the genetic data? Is that my own? Is that something I have in common with my family, and therefore it's also theirs? Or with a large group, maybe all men, or even with mankind? Therefore, you can ask yourself, are they my own? And I think that the violation of my data, it's so easy, it's so important that if I'm getting use of it, I'm getting something out of using other people's data, then I have to receive, I have to give back what I've received. And of course, it's very important that the data I give, they are anonymized and depersonified as well. We might also think a little about the difference between informed consents in the use of data in public health. It's very sensitive for most people. On the other hand, when we're downloading apps on our phones and iPads and so on, we are, without any problems, giving consents to the app providers, an internet service. And there's no problem, and we don't even read what we ought to read. And the companies can pick out all the data they want on in a topic and use them. So therefore, it's a strange thing that we are we want security when it's about our health in the hospital, but not when it's about giving our data to the app providers. For me to see, it's very important that when you receive data or treatments that are based on other fellow humans' data, then you have to give back. And just as you're giving blood to a blood bank, you're donating blood, and you're donating your organs. We don't hope we we have to, but some of us have signed this declaration, and therefore I think what we need is a bank of healthcare data that is available for other patients. And I think in Denmark we have a fantastic opportunity to do that, because we have much more data about everyone than in many other countries. But of course, the condition should be always informed consent. The problem in this is that when you're young, you very often think that well, I will never get sick, and my privacy is very important according to my data. But when you get older, you really need a lot of data in the healthcare system, especially the things that can make a better life for you. So things are changing through life, and one of the very good things about Corona, our Corona thing, there's a lot of bad things as well, but the things that really changed during the last year is that people are more willing to share data with others than we have been ever. And I think that will change the whole industry and the whole way of thinking during the next couple of years. So actually, therefore, I think it's ethical. It's not ethical acceptable to weight your own health over societies. And that's actually what I want to finish with, and then we can start up a discussion, because of course I've got some meanings that might be tricky for the industry. Thank you.